Hey everyone, welcome back. Today we're going to talk about minimally invasive glaucoma surgery. This is a surgical technique that's becoming very popular amongst ophthalmologists today. And basically, it's a way to address glaucoma surgically without any of the heavy surgery like the older school techniques, such as a trabeculectomy or a tube shunt. Let's jump in. Okay, today we have a special treat for you. As part of our MIGS series, I'm going to highlight one type of minimally invasive glaucoma surgical technique. Today we have the Hydrus device. The surgical video is provided by none other than Dr. Bach Nguyen from Houston, Texas, who is a brilliant MIGS surgeon. Before we jump into any surgical device, we should always focus on the anatomy. In glaucoma, there's a couple key things we need to talk about. First, the ciliary body is in the back of the eye, and it makes fluid called the aqueous that travels around the pupil margin and the iris and exits the eye. First, to exit the eye, it passes through the trabecular meshwork before going to Schlemm's canal. After going to Schlemm's canal, then it goes through the collector channels and then out through the veins of the eye. In glaucoma, there's often an increased resistance in the trabecular meshwork. If there's a resistance to outflow, this allows pressures to rise inside the eye since fluid can't escape, and thus the optic nerve is damaged in glaucoma. So now let's take a look at an animated version of this minimally invasive glaucoma surgery featuring the Hydrus device. The Hydrus surgery is pretty straightforward. First, we make a temporal incision into the cornea. We then advance the instrument forward, touching trabecular meshwork right next to Schlemm's canal, and advance the Hydrus device forward. The device beautifully slides forwards into Schlemm's canal, and as you can see here, there are three windows of the Hydrus device that sits in the trabecular meshwork and Schlemm's canal, thus allowing the outflow from the eye. Now let's take a look at a surgical video featuring Dr. Bach Nguyen, again from Houston, Texas. Here you can see him advancing through that temporal corneal incision, reaching across the eye, touching trabecular meshwork, and then advancing the device right into Schlemm's canal. How long did that take? Just a couple of seconds? Well, yeah, that's because Dr. Bach Nguyen's a brilliant glaucoma surgeon. But as all surgeons, we're perfectionists. Here you can see him using a secondary instrument to further advance the Hydrus device into a perfect position. Again, beautiful surgical technique. As a result of that very quick but elegant surgery, we were able to surgically address a patient's glaucoma. Anyways, I hope you found that minimally invasive glaucoma surgery video to be educational and enlightening. Thank you again to Dr. Bach Nguyen for lending me his surgical video. And don't forget, as always, your eyes tell. Thanks for watching. We'll see you next time.